Well, where do you stand on Obamacare? I know you're not a fan of it, but there's a difference between repealing it and then repealing and replacing it with something. And if I remember correctly, I think that was where you were going in the past. Maybe I'm wrong, and you can correct that.
We can't go back to the situation we had before that law. That was a problem, which is what led to the passage of this misguided law that has actually caused
a lot of people say
harm to us.
On the conservative side that Speaker Boehner over the last few years is not serious about repealing it and has not done all that he could, and that would include, I guess, your time in Congress too. My question to you is, if elected and the Senate goes Republican, would you vote to repeal the Affordable Care Act?
We need to have a fresh start, and I can't imagine there would be any vote to repeal the Affordable Care Act that wouldn't be accompanied simultaneously by a plan that actually would make sense for the American people. We have to have a plan that makes sense.
And would that be? Go ahead.
We have to take away the barriers between all of us and our doctors and the folks who are providing care to us. And right now we've got just too many layers and too much cost.
And Congressman Maloney, again, when we interviewed him, he said he's not a fan of Obamacare. He said he wasn't in office when it was passed, and he said he would like to see several changes to it. And he also, I believe, voted to delay the implementation of basically the bones of the bill.
But not the individual mandate. He
Okay.
did not vote to delay the individual mandate, and that is a hardship causer for our
What has been the effect of
folks
Obamacare in New York? I mean, I know it's not fully really in yet, but what is? I mean, have you been told of any? Because he said that he was told by small business owners that they're worried about it because of the the uncertainty
Look
going
at the
forward.
definition of full-time and part-time work. To define full-time work as 30 hours a week, and then put that obligation on our employers, on these small businesses to provide more costly insurance than they could get in the past. Our insurance, people tell me all the time. I heard from one poor guy who went to the pharmacy counter to pick up his usual prescription, and they said, you're going to need $3,000 because you've got to pay your deductible up front before you can get this prescription covered.
So you're saying the negative effects are already taking place.
The negative effects are ongoing. Everybody's insurance is costing more. Again, because people are seniors who rely on Medicare. I took care of seniors relying on Medicare for 20 years in the Hudson Valley, and my parents, are 93 and 90. I know how important it is. Nearly $1 trillion. $716 billion, I think is the figure, comes out of Medicare to get shifted to pay for this law. Essentially, again, paying insurers and bureaucrats to manage our health care. That's not the way it should be.